Oh, super.
Good afternoon, colleagues.
Hi, good afternoon.
Prof
Hi.
Margaret.
Hi.
Are you well?
Yes, yeah, I am. Yeah, no corona. No corona.
No corona. That's always a great reason to smile.
Yeah.
Yes.
And how are you?
We're just waiting for. I'm good. I'm good. So fortunately, I have also not picked up corona as yet. So that's also a good
Very
thing.
good. Yeah.
Yes. Yes.
And are we now in a presenters room, or is this the
Yes.
actual online?
This is the actual session. We're just waiting for some of our other colleagues to join us. Sarah, I see you are also already here.
Good afternoon, Prof. Good afternoon, Prof. Yes, I'm already here.
Ah, that's great. That's great. Thank you. Thank you. We will commence just in a little bit. I think we'll just give our colleagues and participants just a little bit of time to connect. Oh, I'm seeing so many familiar names. I am so delighted to see who is here. Bernard, it's great to have you with us today. Welcome to all my other colleagues. Prof Margaret, I see you are with us as well. So we are just waiting for two of our presenters, just for a second. I see the SPMA colleagues is here. I see we have colleagues literally from all over the continent, even other countries. That is really great to see everyone. So as you know by now, with anything online, if that's one thing that we have learned this year, it is to make use of all the various digital options available to us. So let's just give it 2 more minutes. Yes. Bernard, welcome. Nice to have you with us. I see quite a number of our PhD students also here. Colleagues from our PASCA network, which is really great. It's fantastic to see everyone. Hello, Tiberius, Remy, Professor Ayede, all the way from the University of Ibadan in Nigeria. So we literally, as I've said, have so many people joining us from all over the continent, and that is really fantastic. Good friend to the school as well. I see Professor Suban, Mogi Suban, UKZN is also in the house. Thank you. I also even see some prospective PhD candidates are joining us, and also some of our former candidates. I see Prof Jose has also joined us. So let me just have a look. And so we're literally just waiting for Prof Fernandez. And if I am not mistaken, it is quite early where he is. Prof. Josiah, I believe the same in your case. Let me just quickly check where we have Prof. Fernandez. I see we also have Ambassador Fisher that has joined us. Thank you so much for joining us. It's an honor to have you with us. Thank you for being here, and thank you that everybody has set aside time. So I should actually say, yep, it is 7 o'clock in the morning in the United States, so bright and early. I think before we, I'm sure Prof. Sergio will join us in just a minute, but Prof. Margaret, I think we could perhaps, if you would allow me, just before hello Prof, it's good to see you. If you would allow me, just before we start and before we do the official welcome and introduction, I know that quite a lot of our participants, the one thing, as I said, that we've done a lot this year is online meetings, but not a lot of people, though, are familiar with the format, what we are using now, which is Blackboard Collaborate. So we are so used to Zoom and Teams. So just before we all start, let me just, with permission, do just some housekeeping before. So in terms of how Blackboard Collaborate works, as you can see, firstly, welcome to this session, and specifically as we are making use of Blackboard Collaborate. It is what the University of Pretoria use. We are also recording the session, and the session will be made available to everybody at a later stage. So just before joining, it is important that you do check your audio and your video. Now, your video, and if you won't mind, I'm just going to send it to the next slide. Now, the first thing I want to show you is, so it's just to make this a little bit easier. Let me choose orange. If something is, for example, a little bit small, maybe such as the webinar invite that was on, if you click on where I have indicated in orange, you will notice that it gives you, if you click on it, it gives you options to enlarge this presentation. So that is what we refer to as the show view controls. So you can enlarge the screen there, or so that it is to your liking. If you have reached the age where I am, I either need my glasses or a bigger screen. Now also, just for clarity, you will see that you have down here, we have a little person, and that is where you raise your hand. And I've seen that quite a lot of people have practiced that already. So this is where you can just raise your hand. So because obviously, as you know, we are not in a physical session. So that is where you would raise your hand. That is also next to it, you will have now, you will have your, or in between the avatar, if you click on the avatar, you will see that there you have options. You can have an option such as, for example, agree or disagree, satisfied, happy. They are just, that is where people normally want to know you know, if there is perhaps a point that you really want to stress, yes, I agree with what the speaker has said now. Then also you will see that there is the microphone. Now we are going to ask everybody to please keep both their microphones and their videos, apart from the presenters, switched off during the session, primarily because it saves on bandwidth. And so also it will save you a little bit of data, so money. It saves some money. So yes, so in the meantime, please feel free to practice your raise your hands, and then you can also lower your hand as well. And then once we have questions, then we will, when we go into the question phase, which is a little bit later, as you've seen on the program, then we will make use of that function. Then also, you will notice that here we have, so I always say it looks more to me like bubble gum, but that is the chat function. So please make use of the chat function in between the discussion, something that you want to stress. Maybe already there would be a question, and I will be monitoring also the chats to see if there are pertinent questions for any of our presenters. And then also, if you would like to, you can switch on your video when you have a particular question. And I think just before I give over to Professor Margaret Chitiga-Mabugu, who is the director of our school, I would also just maybe, so that we can get used to the chat function, maybe just type in your name and from where you are, which institution you are representing. That will just, so that you can become accustomed. You will also actually see that, unlike with quite a lot of the others, you can also have use emojis. So I will see you in a bit. I am now leaving you into the very capable hands of our director, Professor Margaret Chitiga-Mabugu. Thank you. Prof. Margaret, over to you.
Thank you very much, Prof Holtzhausen. And thank you to everyone who is joining and who has joined us. Let me, on behalf of the School of Public Management and Administration, the SPMA, extend a very warm welcome to all of you present, especially, of course, our distinguished panel. It's wonderful to see all of you. But please allow me the indulgence to skip protocols. Just be assured that I recognize all of you and, of course, the offices and institutions that you represent. We meet at a time that is a very difficult time for the world. The current devastating COVID-19 pandemic has shown us the importance of disaster preparedness and resilience by exposing our fragility. As of yesterday, globally, more than 51 million had contracted this disease, and sadly, more than 1.2 million have died from the disease. As you know, in Africa, South Africa has been the worst affected, with currently more than 20,000 deaths already recorded. We know too that global economic growth is projected to contract by at least 5% in 2020. Sadly, the outlook for South Africa is no better, with growth projected to fall anything between 7 and 10% in 2020. These are things that we have not seen in many decades, and even, well, sometime back in this century. We know as well that millions of people have lost jobs and that many businesses will not recover. Governments have lost revenues and yet have had, at the same time, to shield economies as well as livelihoods. There are, of course, many other devastating things that we are all aware of that are affecting us in one way or another. Governments have been central to the responses to this disaster, and their resilience has therefore been severely tested. In particular, municipalities or local governments, being closest to the people, have especially come under the spotlight. Service delivery and policy gaps have been exposed. So in order not to waste this crisis, we've decided to ask what lessons have been learned from the disaster, and specifically how resilient governments have been and can still be going forward. We think that these questions are important as countries are already dealing with second waves of the pandemic, but also as countries position themselves for possible future disasters. Today, therefore, our discussion is guided by the topic, Resilience in the Wake of Disasters, the Municipal Voice. To me, one simple definition of resilience implies the ability to recover quickly after difficulties. But I believe hidden within this definition are some very simple and pertinent key concepts, such as the ability to prevent disasters, ability to withstand disasters, ability to mitigate disasters, ability to bounce back quickly after disasters, and ability to learn from the past. So the experiences from Europe, from North and South America, as well as Africa, will be shared today by our panelists. We're therefore looking forward to these discussions and to you, the audience, engagements with this panel of distinguished scholars and practitioners. So once again, a very warm welcome today. Enjoy yourselves, engage, and let's come up with solutions that would assist our governments and therefore assist us. Thank you, Madam Facilitator, and back to you.
Thank you so much, Prof Margaret. So I would once again like to welcome all our esteemed guests, not just our presenters, but also everybody from literally all over the country and the continent, and we have quite a number of people from all over the world. As I have already briefly mentioned, a special welcome to a former student of ours and the ambassador, Dr. Fisher, welcome. And then most of you are friends of the SPMA family, and we are here to really discuss the issues at hand. Prof Margaret has shared with you the concerns that disasters bring, and we have thought that, you know, given also the magnitude of the problem, and you know, in the wake of disasters, and we know that COVID will not be the last disaster, and I think so many lessons were learned already. And as we know, on grassroots level, this is where our municipalities are. This is where the tar hits the surface, or what do they say? The tire hits the surface. I don't even know what the expression is, but this is grassroots level. And we are really honored to welcome our esteemed panel today. And we really encourage you to also engage with them after our session. The first person, and I'm just going to if you would allow me that in a bit, just swap around the presenters. And I'm going to ask that our first presenter, Prof José de Oliveira, that he will be the first one. And just to give you a little bit of background, and I know you have seen their very impressive biographies. He is an associate fellow with the United Nations University in Kuala Lumpur and the MIT Joint Program on Science and Policy for Global Change. Not only that, is he also a faculty member at the Getulio Vargas Foundation, as well as a visiting professor to quite a number of universities. He has got over 20 years experience at various institutions, think tanks, government entities, and international research entities as well. He focused a lot on political economy of sustainable development, which is by far one of the biggest issues that we are facing currently. And he also works on policy implementation. Now, professors, we are really looking forward to hear from you and to learn from your insights that we have had, or that we can learn from. And I'm sure that all our participants will learn quite a lot from all of our esteemed guests. But firstly, I would like then to welcome Professor José de Oliveira. And I hope I've pronounced that correctly. You are welcome.
Yeah, correctly. Yeah.
Oh, fantastic. You are welcome.
Can you hear me?
We can, thank you.
Yeah, thank you very much for the invitation, Professor Natasja Holtzhausen, not sure to say your name correctly, and Professor Margaret, that I know well. And then I really look forward to participate in this debate. I have a presentation that I'm going to share, with you. I'm not sure I will be able to, okay, I can change this slide, no, I think.
Yes, you are welcome to, Prof.
Yeah, thank you. My discussion is not exactly about local government per se, but the intergovernmental relations that help in the response of the COVID crisis. And you made an analysis of the BRIC countries. That's Brazil, Russia, India, China, and South Africa. And somehow it's changing by itself, the presentation, how I control it here on my side. Let me see here. And firstly, the challenges related to intergovernmental relations. Most of the countries, as you know, there are several levels of government, and the intergovernmental relations are how these different levels are connected, but also importantly, the intergovernmental relations at what's a horizontal level between the sector. Because COVID, at first glance, people thought that would be just a health problem, but it's ending up being a multi-sectoral problem because it affects economy, affects education, affects transportation, affects agriculture and production industry. It means it's a multi-sectoral. That's why these intergovernmental relations are very important for how these sectors give a coordinated response at different levels of government. You're going to focus mostly on the, say, vertical relations between the different levels of government. And because, interestingly, literature have talked a lot about intergovernmental relations. but still there are a lot of unanswered questions. What best way to have those relations and to organize the different levels of government to coordinate among each other. And you want to see is kind of the countries that gave effective responses. They had very good intergovernmental relations. They're going to show there is not answer for all. In the beginning, people thought, I would say, the more authoritarian, centralized governments in Asia, they were very successful, like China, Vietnam, because they have very kind of top-down policies, were easy to control the intergovernmental relations. But later you saw many more democratic countries and places. They also had good response, I would say, like New Zealand on side. You also have Taiwan, Korea, and Japan, too, very late were good. Now it's getting worse. It means the intergovernmental relations, people thought is much more complex than only the state system. And then there are now a lot of efforts to try to understand better, particularly in I would say, countries that are called late democracies, countries like, I would say, South Africa, Brazil, India is not that late, but also is kind of into formation. These countries, how you organize the different relations between the levels to have effective responses to crises like COVID and others that may come in the future. Okay, sorry, just changed too quickly. And said that our work, we concentrate in the examples from the BRICS. This is a work actually I'm doing with a few colleagues from the 4 other countries. And BRICS, as said, is very important because they comprise around 40% or more of the world population, and also more than 1/3 of the GDP. And they are, as you're going to show you, they respond very differently from the crisis. This is the graph of the responses and also number of cases and deaths. And when you did this, finalized this research in September, the BRICS were all 4 of them, except for China, where it started. That's an important country, but the other 4 BRICS is among the top 5 after the United States in number of cases. When you finalize these analysis, you saw that the BRICS are important not because of the size, but because they were important, I would say, actors in this crisis, because China, where it all started, and the other BRICS countries been suffering a lot due to the pandemics, and still not controlled in those countries. The number of cases still going up. And the method, you basically did secondary research. You had this table, you can't see much, but you organize a table with 52 different items related to intergovernmental relations, from budget to transfer of autonomy, and you made this analysis for the 5 countries. And based on those analyses, you kind of compile the main results from this, what you could get from this. What I'm going to show you is basically a summary of these analyses. And let me see here. And then you, based on this research, you thought, like, what the 3 most important points I selected for this presentation that factors that can understand the intergovernmental relations. And the first was like political state system, how countries are organized, the formal, informal process that I would say that's this relation between the levels happen. And finally, you found also the political alignment, how the different levels are aligned politically. And that may not be that important in countries that have a one-part system, but they are very important for countries with multi-party systems like Brazil and India. And I'm going to show you some of the main results. And first, let's talk about the political and state systems. You see, the 5 countries, they have different levels of government and different systems. For example, in Brazil, you have 3 levels of government: the federal government, the state governments, and the municipalities. And they are all independent from each other. It means the roles are stated in the Constitution, and they are independent from each other. The state does not control everything in the municipalities. It's kind of have own independence, own political system. And we talk, for example, interesting in Brazil, the health system. You have 5,570 municipalities. You have 5,570 different health systems, different primary education system, because every municipality has its own system with support of transfer of resources from the higher level, but basically the municipality decides about most of the system. And while, for example, in China, you have 5 levels of government, but you don't have, I would say, autonomy, because you have one-part system, and basically what happened at local level can be determined at higher level because of very hierarchical system. While I'll not say all the countries, but while in India, for example, you have basically 5 levels of the government depending on the state, but the most important is state in terms of health and most of the functions of the public administration, because the state is, for example, the health, and each state has what they call panchayats, or local governments, like 3 levels for the state. We are studying the whole Kerala in the South India. They have 3 levels of panchayats, I would say district and local, and then the middle level. And these levels, and each state determines how much autonomous they are. But in terms of all the functions, including health, and then some states, for example, we're studying, they have very important role on that. And just stop my slides, but I will kind of continue. And this is what you saw. Can you see the slides? Hello? Stop my present.
Don't
Prof,
see the slide.
I will just put it on again. So
Yeah.
don't worry.
Yeah, and then just wrap up. It means, okay, I was talking about, sorry, this part and the 3 points, and you have in the political system, there was this very important how the states are organized, how the political system is organized. For example, Russia is a federation, but different, for example, from Brazil and India, the other 2 federations. Russia has a very, I would say, centralized kind of government. It looks more like China than more than a federation like India, the system when they put together political state system. And these influence a lot how the response were done, because in countries like Brazil, the municipality has to agree with the state, the federal government, to have some action, some response in health. If they don't agree, you can have problems, because I've seen many cases where they have different visions of the actions, and you have very discoordinate actions among the different municipalities and also different states. Because if the municipality doesn't agree with the state or federal government, they can do by their own way, and with responsibilities locally, but they cannot be forced to go in the way of the higher level government. Different from China, where when something is spotted, and the federal government, the central government can actually step in the actions and also give those response. It means is the state and political system, as I said, is very important. And this is another point to find how these institutions for intergovernmental relations are organized. You have divine informal and informal institutions, and they are very important for effective response, because how you kind of coordinate, particularly in a crisis, you need very quick coordination, and the countries always have what's called the institution gap, because certain those institutions in many countries, they are laid out in the constitution, how it should work, but as this word changes, like a crisis like COVID probably was not envisioned when they wrote the constitution. Because a lot of these look crises like war, but most of the constitution, they didn't look for climate change or COVID. And then these institutions, there are a lot of gaps, things, particularly countries where they are divided by different responsibilities, so health in Brazil, I give in the country levels, different kind of health systems. At the local level, in general, more primary health care, and more sophisticated healthcare is state or state government, and sometimes some states have also federal, but most of the state. It means if they don't coordinate, if the patient gets really sick, it needs to change hospital, we change from municipal to a state hospital, and sometimes may have a lot of coordination in terms of beds and who actually should be transferred from one hospital to another. And there are a lot of problems that is not formally written in our political system, should be worked out in the public administration a lot of times, and they don't agree for different reasons in terms of resources or political reasons. I mean, these formal institutions are very important for this coordination. With sometimes they don't exist, they need to have informal kind of institutions, and these work different in different countries. And in Brazil, there are a lot of problems in terms of definition of responsibility in the health system, the three-tier system, municipal, state, federal. While India was less than that, because it's more state responsibility, and even there was not much disagreement with this federal level. It was much more smoothly. There are all the political difference, but in the end, they just work out solutions. It's the formal informal institutions to respond very important, and I was very linked to the previous slide on the organization of the states and political system, how these, particularly the informal institutions, they need things they're not written on paper on the institution or some law, how the different levels work out with each other informally, or through political negotiation, or through internal administrative negotiations for transfer of resources, transfer building hospitals, or who is responsible for what. And you will see many of these countries that are federations, they have a lot of problems on that. A lot of these, I said, it's not, people didn't think about COVID when they wrote the constitution, like in Brazil in 88, in South Africa in 1990s, or India in 47. For example, how these different levels should work out in a crisis like this. And then this is annoying. And finally, we saw the kind of political alignment that's not very important, like countries like China, one-part system, even though the party in China has different, I would say, political ideology internally. but you didn't see much. But you saw a lot of those problems in countries like Brazil, where the political system basically deterred a lot of things that happen in public administrations. You have, since, for example, our president, Bolsonaro, he was in favor of some medicines like chloroquine, for example, or hydrochloroquine. And why some state governments agree and distribute chloroquine freely to the patients, the other disagree, even ban chloroquine from the system. And we have now the problem with the vaccines in Brazil. There are 7 vaccines being tested in different states for different vaccines, and the federal government has owned the vaccine they are supported, the Oxford, then in but like for example in São Paulo they are supporting the Chinese CoronaVac, and then there are a lot of disagreement. When the vaccine gets ready, who is going to buy it and who is going to distribute it? The people, for instance, São Paulo adopts the Chinese vaccine if they're going to be able to distribute to others or other states or people from other states. And it's a lot of problem because there's a lot of politics. You see these also outside the BRICS in the US, United States, not simple. In China, it's much less, say, in Russia, because the alignment, but you have in countries where the political system feel a lot of voids in that intergovernmental relations, and when the politicians don't agree, the public administration is not the health system is not able to function properly. Problems and what you see in Brazil, a lot of some places work well, some municipalities, rich municipalities, where they can afford mostly of the health facilities by themselves. They can decide basically what they want. They don't depend much on the state and national, but other municipalities, very small municipalities, they really need to work out the political alignment with high levels to get the resources. And you see that sometimes there are not resources for all. And these 3 points, just finalize that we're seeing still going on in the research. It's going to actually be published. You just got this week, and I can send you later in one of the journals. But you have these remarks, these 3 systems. First, there is no silver bullet for COVID in terms of what works better. I think coordination is necessary, important, different levels, particularly for the municipalities. But there is no right system to do that. You see countries very down, like China, work well, but also see outside the BRICS some democracies, more decentralized system, and even within for example, India, some municipalities in Kerala were working, they did very well, and it's a very decentralized system, but they did very well in terms of health provision. But others not. There is no. There are different ways the country in their own system have to find out, and I think possibility for the system to do that. Second, you have these relations and varies a lot among also different levels, and some levels are very it's laid out in the constitution, but other not that much. The subnational like from the states in India that define how much autonomous will be the municipalities, and these varies a lot in terms of country, and different states have different system. And in terms of research, it's also good to see how this relation work out. And finally, you just say that these crises, as I said in the beginning, it's not just a health crisis that we fought. They just need to have hospitals and ventilators. But the scene now is lasting much longer. And even things that countries they're doing very well in the beginning, now they are doing it could not last much, because if you have a lockdown for 2 years, no one there, or some countries that the lockdown can be done for a week, because there are a lot of informal sector people depend on the daily wage to survive. They can't stay more than a week at home, and then see countries like South Africa, India, Brazil suffering a lot. It means that people thought that was going to be, I would say, health crisis, but end up being a motorial, and then is evolving as we speak across the world. And to get things more, you didn't have the response before. For example, the education system, how it happened in some places, the kids haven't started the year yet. How the education system respond, and people see the trend on just postponing the decision. Let's wait the COVID gets better and then go back to classroom. But it's not going back, and how you actually make this change. And then particularly municipalities, small municipalities, they are much more vulnerable because they have less resources and less autonomy to decide, and end up being worse off in this situation. I think I just stop here and give back the word to our moderators, and look forward to hearing what our colleagues also have to say. I see a lot of questions here, but I'm not sure I can see it. Maybe I'll answer those questions later on, or right in the chat box. Thank you very much, and give back to you, the moderators. Thank you.
Thank you so much, Prof. de Oliveira. So what we are going to do is we will have a Q&A at the end of our session after all our presenters. But there is no harm in already answering so long in the chat, because this is how we keep the engagement going. So, Prof, there are already 2 questions in partly answered, one by Professor or Dr. Fisher, and then the other one by Nhlamulu. Decent, is that you? It's good to have you with us. So thank you, Prof. Jose, very informative, as Prof. Fourie has also now indicated. So I'm going to ask the members of this specific session to just either post your questions in the chat or leave them for afterwards. This just allows us also to save a bit on time, and then also to keep the discussion going. So, Prof, you can already just have a look at the questions and ponder some answers and even reply to them. And then that could also stimulate more discussions from
I'll do that. I will use the chat.
Super. Thank you so much, Prof. So our second professor and presenter, it's all the way, and he had already greeted us from the Netherlands. It is Professor Dr. Martin van der Steen, who is also the Associate Dean and Deputy Director of the Netherlands School of Public Administration in The Hague. He is also involved, as you can see, all our guests are involved in a number of universities and programs, and he's also quite involved with the School of Public Leadership at the University of Stellenbosch, and I am very happy to say that I saw some of our colleagues and friends in public administration. We are quite small, so it's colleagues and friends and family members all over from the School of Public Leadership. So welcome once again to all of you. I actually forgot to introduce myself. So I am Natasja Holtzhausen, and I am the facilitator for this wonderful session today. You will also see that Professor van der Steen has worked on so many commissioned research projects which focus on new modes of governance and policy fields, which includes, and this makes me think of the comment also posted by Ambassador Fisher, what we could learn from BRICS, but then also what we can learn from all the other countries involved, which relates from education, policy, health, citizenship, social enterprises, Prof Martin, you are welcome, and thank you for sharing your thoughts with us. So let me just share now your presentation.
Okay, great.
And you can move it as you would like to. Thank you. 15 minutes. Thank you, Prof.
Yes, perfect. Thank you very much. And I will try to keep time. And in fact, I just put on a timer so I can I can make sure that I do it in 15 minutes. Thank you very much for the invitation, and and good day to all of you people from all over the world, I can say. And it's very good to see you all here. And I'm very pleased with the format. So presentations by us speakers, but I think also very nice to see a lot of comments and reactions, and I think it would be nice to turn this really into a conversation. And as my part of that conversation, I wanted to share with you some insights from the Netherlands. I've been involved in a really big commissioned research project, being involved in, you could also say, almost drowning in this research project, because we are looking in real time into the Ministry of Health in the Netherlands, and we're in real time watching and analyzing all of the policy responses that they are putting out. And we've been doing so since the beginning of the COVID crisis in the Netherlands. So we have you could say, an holistic view actually of the entire COVID policy approach in the Netherlands. And I will try to share with you some observations from that. They're not specifically about local government. There's a lot to say about different relations between local government and national government in the Netherlands. But I would like to focus on something slightly different, and that is actually the question: what kind of a policy issue, or what kind of problem is COVID, and what does that mean for the way you can handle it, or deal with it, or make policy or governance for it? And so that is what I want to talk about. And this picture is actually it's on the cover of our study so far. It's in real time, so it's adapting all the time. But this is actually, I think, at the root of the problem. We're talking about COVID-19 policy response and policy for COVID-19. And I think one of the most important questions is, what exactly is COVID-19? What are we dealing with? And on the left side of this picture, you see, I think, a probably familiar picture. It's the curve. And we all have been talking about the curve, bending the curve, breaking out of the curve. And in fact, if you look back in the Netherlands, we are just at the end of our first wave, first curve. We are entering now the second wave. And in hindsight, you see a curve, and you can analyze and evaluate the policy responses in relation to the curve. I think the real interesting point is that if you look in, if you go back to what practitioners, policymakers knew when they had to act and had to respond to COVID as when it was still an emergent crisis, it's not like this. I hope you can see this hand in your screen. It was not like this, that you know that it's a curve and you're in the beginning of it, or in the middle of it, or at the end of it, but all you can see is a big blur that is coming for you, and you don't know where you are actually. And so it's policy making under deep uncertainty, under very fundamental ambiguity. So you have to make policy for something you don't know, and not you don't know. It's not that you don't know it because you're not paying enough attention. I think the reality is that you don't know because it cannot be known. And that is, I think, a very important point to take into account when looking at policy making. Now, if you take a step back and conceptualize this, I think it's a very good distinction to keep in mind, that in systems thinking, there's a very important distinction between what we call complicated systems and complex systems. And these two words, they look the same. They are also often in daily speech used interchangeably. So we call things complex or complicated sometimes, and we don't really pay attention to the different meanings of those words. But complicated, from a systems perspective, is entirely different. A complicated system is a system when there are many components of the system and many different relations between components of the system, but these relations are stable. and they can be known. So natural systems, for instance, or mechanical systems, the engine of a car, production facilities at a factory or a chemical plant. These are very complicated systems. A space shuttle, a spaceship, building a spaceship is very complicated, but there are people who know how to do it and they can replicate it and they become actually quite good at it. It's a complicated system to know, but it can be known and it can be explained and it can be rationalized. Now the complex system is entirely different because in a complex system there are often many parts, but that's not really the fundamental thing. The fundamental thing is that the relations between the different parts are not stable, but they are dynamic. They will change over time. They will change as different components in the system, different people, they interact with each other and they learn and they change their behavior. So these are often social systems and they are complex in a way that they cannot be known because they are changing all the time. And they're ambiguous. And I think it's important to make this distinction. What type of system are we looking at? And if you want to put that into drawings, the left picture, this is, I think, a typical example of a complicated system. It works through the laws of physics, and it always takes the same movement. It's predictable, you know what's going to happen. It's difficult to understand, you have to learn for it, you have to know physics to understand this system. But once you do, you know all of it, and you can entirely predict it. Now the right picture, it looks a bit the same, but as you can probably imagine, the effect of releasing this child is entirely different from releasing this ball. It looks the same, but the dynamics will be entirely different. The left one is entirely predictable once you know it. The right one is entirely unpredictable. And I think that if you look at COVID response, COVID policies, COVID prevention, but also how to learn from the crisis, you have to be really precise about what type of system or what type of problem you think you are dealing with. And I think that many governments are actually treating COVID like this left side, like it's a complicated policy issue. But I think it's important to distinguish that it's a complex policy issue and that has huge consequences for the way you deal with it. It means that in terms of this matrix, you probably know it. If you look at the known or unknowns, I think we are dealing to a large part with unknown unknowns. So COVID is not simply a known crisis. We know how viruses work. We know that we can, through medical research, probably at some point produce a test, a reliable test. We already have that. Maybe it can become a little bit faster. We can probably at some point develop treatment. And hopefully, and we're working on that, we can probably at some point develop a vaccine. That's all in the known world and partly also in the known unknown world. We don't know it yet, but it can be found and it probably will be found in 5 to 6 months. However, I think the root problem of what makes COVID problematic is not so much the medical aspect of it, it's much more the social and societal aspect of it, and that is much more a complex problem, and then you delve into the unknown sphere of this matrix, and I think you go into the unknown part of this matrix. So a lot of policy for COVID is not about developing a cure, it's much more about how to deal with it, how to deal with all of these unexpected and often, of course, unintended consequences of the coronavirus. And so how to deal with economic difficulties. And we know the number of 8% less growth, of 8% decline in the economy, but what are the consequences of that? And that is, I think, an unknown. And in terms of policy, I think it's very important that we look at policy and governance that can deal with unknown unknowns. Now, how to do that, and Margaret in her introduction referred already to some of these concepts. How do you organize for something that you do not know, that is complex and that cannot be known, that is an unknown, and how do you organize for that? And I think that the work of Nassim Taleb is very interesting in that part. Anti-Fragility is his famous book, one of his famous books. The Black Swan is one of the others. And I think he provides us with interesting concepts to think about this. And the first concept he uses is the idea of robustness. So you can plan ahead or organize for crises through the concept of robustness. So you build dams, walls, dikes, spare capacity in a way to, let's say, absorb or hold back the effects of the crisis. And that is, of course, something that is often done. In the Netherlands, we have the country is below sea level, so we have to build dams to keep the seawater out. And I think building a dam is a very good example of a robustness strategy to deal with external shocks and crises. And that is a strategy for dealing with unexpected outcomes that is often used. The other strategy, as Margaret already also explained, is resilience, the idea that you can recover as quick as possible. So in a way, you accept that you cannot keep everything out, you cannot keep the crisis out, you cannot keep COVID out, but you can organize your system in a way that is able to recover as quick as possible, and so it returns back to the state that it, that you came from. And actually, the picture that you're seeing here is what we call a water square in the Netherlands. And the idea is that with excessive rainfall, you don't the sewer system overflows, and instead of expanding the sewer system capacity, that would be a robustness strategy, we've built these water squares, and these are squares where when there's excessive rainfall and the sewer system tends to overflow, the water fills these squares become basins for overflowing water, and that gives a little bit of extra space to the sewer capacity. In a way, you let the crisis overflow you, and then once the rainfall has stopped, these squares slowly empty out and everything recovers to what it was originally. And it is a resilient strategy to dealing with, in this case, excessive rainfall, but it's also a resilient strategy to deal with, well, possibly effects of crises. Another strategy, and this is the one that Taleb puts forward, and I think that is the most applicable to COVID, is what he calls anti-fragility. And the point of this strategy is that it's not possible to know COVID in advance. So the only way to get to know it is to interact with it and to almost in real time deal with it and find out in real time what works and what does not. And so in that way, try to take, let's say, an improvisational approach, a learning approach to dealing with COVID, where you can still plan ahead for those elements that you can know ahead, but that you also be very careful in defining what parts of the crisis cannot be planned ahead, cannot be known ahead, and that you take a learning strategy for that. And that means that you try out measures and very quickly try to learn what the effects of these measures are, and then try to get back to scale them up, or maybe develop them a little bit further, adapt them, or roll them back as quickly as possible. And so in the literature we call this the hammer or the dance. The hammer is the big full lockdown intervention. It works all the time, but it has huge costs. And the dance is trying to make small changes, see how they work, how the system, the complex system, responds to it, and then see if you can scale that up or adapt. Now, if you look at the Netherlands, I think there are several key questions that are now on everyone's mind, partly because these were the conclusions of our first round of analysis, and that I think for developing COVID policies, it's very important to ask yourself a question: what is this? In my mind, is this a complex issue or is it a complicated issue? And I think that is an important question for you to ask. What kind of system do we see? And from what kind of system perspective do we want to work? Is this complex or is it complicated? And if you say, well, this is complex, which I think it is, it requires an entirely different kind of policy. I think a second dilemma or question is, what kind of issue do we turn this into? Is this a public health issue? Of course, it is a public health issue. Or do we treat it more as a holistic societal issue? And then, of course, if you take the latter approach, then economic effects become very important. Social effects become very important. And that might even contradict with some of the public health policies. Again, it's a dilemma. Both of these elements are true. It is public health, it is societal, but you can't do them both equally at the same time. So it means that you have to choose in a way and have to deal with that. In terms of strategies, anticipation versus improvisation. You can prepare for this crisis, but again, part of the preparation is that you recognize that this crisis cannot be known beforehand, and it also require improvisation. So please build in a lot of capacity for improvisation, and that is oftentimes at the expense of capacity of anticipation. So improvise rather than anticipate. And at the same time, anticipate where you can so that you don't have to improvise everywhere. Slightly, almost the same, but slightly different is the idea. One of the dilemmas that I found very striking in the Netherlands, which was quite well prepared for COVID, but some found out that the plans were just not sufficient for the amount of the crisis. And then the dilemma came, do we stick to the plan? And often it's a good advice to stick to the plan, or do we adapt to the circumstances because the plans are not suitable anymore? And that is a very difficult dilemma for policymakers. How long do we stick to the plan? And when do we start adapting to circumstances and release the plan? And okay. Then I think another dilemma is pragmatism versus principle. Pragmatism means that you deal with what's in front of you. And I think the Netherlands has been quite effective in that. At the same time, in doing so, we have abandoned a lot of our democratic principles and a lot of our, let's say, rule of law principles. So in a way, the approach to COVID has been almost authoritarian, not so very democratic anymore. And that, I think, was in the wake of the crisis a good thing. We needed an almost authoritarian approach in order to deal with the worst effects of the crisis. But at some point, democracy is also a value in itself. And how do you weigh these two values? The pragmatic value of dealing with crises, public health crises, and also the more principal values of maintaining a good democracy and maintaining the rule of law. Also interesting, we are talking about COVID as a government policy problem. Yeah, but maybe it's also a societal problem, and that is interesting. And now, as a final remark, because I'm out of time, I think, one of the dilemmas now is how do we talk about COVID? Is it fighting the virus, or is it living with COVID? And during the first wave, policy was aimed at fighting the virus and defeating the virus. Right now, I think what we are more and more starting to realize is that the virus will be among us for years. And I think that living with COVID is now becoming the new frame of talking about the crisis. We have to live with the virus probably for another couple of years. Even when there is a vaccine, it will not go away entirely. And we have to try to adapt to a new world. Well, this is, where the virus remains among us, and we have to start living with it instead of fighting and defeating it eventually. Okay, thank you for your attention, and I think back to the discussion. Again, you can put away my slides now.
Thank you so much, Prof.
You're welcome.
As you will see from the chats, there are already a lot of interest in terms of what you have said. So in the meantime, if you could also just have a look there. It's really great that we have participants from I see Speyer in Germany, Prague and the Czech Republic, as well as from Poland. And when Blanca made the comment in terms of the V4, I actually, and I have to admit it, and I am blushing, I was not aware of it, and I actually quickly Googled it. And Blanca Fortunately, also, I was one of the participants. We have a very dear friend of mine, Professor Ilona Swiatek, from the University of Lodz in Poland. So I think there, you know, you can also communicate a bit on the topic. As you can see, we will always have somebody who can also contribute to the discussion, and I am sure Prof Martin knows a lot also, given where he is situated. Thank you so much once again, Prof. We truly appreciate it. Now, our next guest is Professor Sergio Fernandez, and he is an expert in the fields of public management and organizational theory. He works quite extensively in terms of representative bureaucracy and public sector leadership, government outsourcing, and he is a very good friend to the SPMA and also collaboratively work with us. His articles has appeared in have appeared in all the top journals that you can think of in public administration, and you would be quite surprised to know that an American knows so much. I don't know what Sergio is going to be discussing, but an American that knows so much about South Africa also in terms of the responses and local government. And that is also a research area that's very close to his heart. I know that. So Prof Fernandez, we're really happy to have you with us today. And we are looking forward to your presentation. And if I may be as naughty as to say, congratulations for the successful elections in the United States. So,
thank you.
Over to you, Prof.
Can everyone see me and hear me? This technology is new to me, so I want to make sure I'm using
we can
it properly.
Absolutely, yes, hear you. Okay. We can see you.
Wonderful, and I can see my slides. So thank you for the warm introduction. It's my pleasure to be here, and I'm very thankful to have been invited to participate. As much as I like to talk about South Africa and do research in South Africa, this presentation will focus on the American response to COVID, particularly the response at the local level in the US. And just to put things in context, when we talk about local government in the US, we have almost 100,000 different local governments in the US, including roughly 20,000 municipalities, but also about 14,000 public school districts. So you'll see that a number of responses that local governments have been taken by school superintendents for these roughly 14,000 school districts. It's also important to keep in mind that when we talk about the local government response in the US, oftentimes we have civil society and nonprofits playing a very prominent role in collaborative ventures and partnerships and just through volunteerism at the local level. So when I was invited to give this talk, I thought the timing couldn't be any better because I'm working on a new edition of a book, and one of my contributions to the new edition is a discussion of positive organizational behavior. Is this relatively new trend in the field of OB, focusing on these positive state-like or cognitive capacities that people have. One of them being resilience or resiliency. So I thought I would start off with a few definitions of what resilience means or resiliency means. And you can see here it's been variously described as positive adaptation in the context of significant adversity or risk. This is resiliency as a human characteristic. The capacity to rebound or bounce back from adversity, conflict, and failure. accepting reality, strongly holding on to values and beliefs, and effectively adapting to unexpected situations. There's also literature on organizational resiliency. So in a similar vein, this has been described as the ability that organizations have to rebound from unexpected, stressful, adverse situations and to pick up where they left behind, or in some cases to even make leaps forward in capacity. The ability to create new capabilities and create opportunities in the face of adversity. So when we talk about the U.S. response to the pandemic in the U.S., there are really two very different tales to tell here. And it has largely to do with the fact that we have a highly decentralized federal system in the U.S. So at the federal level, I think I'm being quite kind when I say that the federal government response to the COVID crisis has been an abject failure. It's been bungled. It's been a botched response. Going back to the early part of the year, even with early indications of the virus in January and February. So just to give you a sense of what I mean here, we have a president who's minimized the health risks of COVID infection and the magnitude of the spread of the virus. The presidential administration has politicized the wearing of masks and business and school closings and reopenings. This has had a rippling effect where now we have many governors who also have politicized the wearing of masks. There's been widespread marginalization of scientific expertise. Early on, there were severe shortages of personal protection equipment, ventilators, a range of other medical supplies. To this day, we have no national testing system or contract tracing system. We've gone to war with the World Health Organization. We've canceled our funding to the WHO. We've even formally withdrawn. And a few statistics just sum up the bungled effort by the federal government to respond to the virus. The US has approximately 4 to 5% of the world population. We have 20% of the world infections. Over the past week alone, we're averaging 120,000 new infections per day. Yesterday, we had 145,000 new infections. And the projections are that we will be between 200 and 250,000 new infections per day and over 2,000 deaths a day by late December. US local governments have really borne the brunt of the outbreak of COVID outbreaks throughout the country. It's important to keep in mind that in the US, education, health, law enforcement, housing, they're largely local functions. In addition, local governments rely extensively on sales tax and state income tax revenue to support their activities, both of which have plummeted during COVID. Fortunately, we do have a highly centralized federal system, grants significant autonomy and authority to state and local governments. And this has created opportunities for local governments to be very innovative, very creative, and to demonstrate resiliency in their response to COVID. So I'd like to show you some examples of how local governments in the US have been able to demonstrate this resiliency and respond in ways that the federal government and many state governments have just been either unable or unwilling to do. So the issuing of mask orders. Local governments were among the first units of government to issue orders requiring the wearing of masks. In many cases before the state required it. And in some cases, local governments have issued wearing of masks in defiance of state orders that recommend but don't require mask wearing. So Georgia is a good example of this. The governor in Georgia said that mask wearing was recommended, but that you couldn't require it. The mayor of Atlanta passed an ordinance requiring the wearing of masks, and it ended up in a lawsuit in court. School districts, and I should add universities, were among the first to basically depopulate, to send students home and to move the curriculum online. In many cases, these orders were issued at the school district level or at the university without prior state approval. Governors fell in line, issued a subsequent order sanctioning what local officials had already done. There have been a number of very interesting examples of how local officials have leveraged IT and social media, for example, creating dashboards to inform the public of COVID infections and hospitalizations, directing people to new services, informing them of policy changes, and new apps have been developed to track symptomatic individuals and undertake contact tracing, at least at the local level. In many localities, there's been a significant expansion of testing, particularly for high-risk populations. So this includes the elderly in retirement homes and people who work in retirement homes, people who work in the food industry, people who work in restaurants and groceries, and the homeless. In many jurisdictions as well, there's been a significant increase in hospital capacity, and they've done this in very creative ways, like they've repurposed empty college dorms, empty schools and recreational facilities to house the sick, to quarantine people, and they've created temporary field hospitals for infected individuals, usually as satellite facilities in very close proximity to hospitals. An early concern had to do with the fact that we have very overcrowded prisons, and local officials were fearful that there would be outbreaks in these overcrowded prisons. Local jails typically house people who are waiting for trial. So these are people who haven't been convicted, they haven't even seen their day in court yet, and yet because they couldn't post bail, they are housed in these overcrowded facilities. So throughout the country, local law enforcement officials have been able to depopulate overcrowded jails by sending people home to wait for trial at home. There's been a number of efforts to support small businesses who have been adversely affected by the decline in retail and other sources of commercial activity. So local governments have repurposed local revenue to fund grants, loans, wage subsidies for struggling local businesses. In the county where I live, a few years ago, they issued a new tax to pay for a convention center. That tax was repurposed to support small businesses, to help them cover costs, including salaries for workers. Steps have been taken to provide support to individuals and families. So again, new grants and subsidies were established to cover housing costs, costs of utilities. Interestingly, many localities have established moratoriums on eviction. So if you're a renter, you lost your job, in many cases, you can't be evicted if you don't pay your rent. Utilities have also passed moratoriums on canceling services for people who can't pay their water or their electricity. There's also been expansion of child care provision for first responders, nurses, for example. Another major concern had to do with our homeless population. Of course, these people tend to congregate either in shelters or outside. They cannot socially distance, and it's hard to quarantine them. So there's been very innovative use of empty hotels, schools, other public facilities to provide shelters for homeless people. Nonprofits have played a very prominent role in this area. And then also efforts to provide food security for people. So a number of food pantries and community kitchens, new ones were created. Many students in the US eat at school. They get free breakfasts and lunches. Of course, with schools being closed, there was a concern that children would go without enough to eat. So many schools have kept their kitchens open and staff in the kitchens working. So families can come and pick up meals for their children, or in some cases, school buses have continued on their routes and delivered meals to students at home. And new services have been created to deliver food for the elderly and people with disabilities. So this is really remarkable when you look at how innovative and how creative local governments have been in the U.S. In the face of adversity. To conclude, despite the failed U.S. government response to COVID, local governments have stepped into the breach. They found innovative ways to mount effective responses to COVID and to contain the spread of the virus in many localities. Resilient local governments operating within a highly decentralized federal system, in the US case, have really prevented a terrible situation from becoming far worse, indeed possibly catastrophic. And finally, the incoming presidential administration has expressed a commitment to using federal authority, influence, and resources to support ongoing state and local efforts to combat the virus and limit its spread. This is going to be critical in the future as we talk about future mitigation efforts that are ongoing and into next year. And also, local governments will play a critical role in any large-scale immunization campaign. If you've been keeping up with the news, Pfizer, one of the large American pharmaceuticals, reported very positive results of a vaccine that's in trial. It's about 90% effective, but the vaccine requires 2 doses and must be stored at about minus 90 degrees Fahrenheit. Well, hospitals, clinics, pharmacies don't have this capacity at the moment to store large numbers of vaccines at that very low temperature. So local governments will have to, again, step into the breach and provide this capacity. So thank you for listening to me. I look forward to your feedback, and thanks again for the invitation.
You are most welcome. Thank you, Sergio, for sharing your insights with us. I see that Prof Gerda van Dijk had already posted a question in the chat room that you can answer. And Prof Martin, there are also some questions for you already that you could respond to. So just to make it clear, if you have a particular question also addressed to a person, maybe just then indicate if it's to Prof Sergio or Prof Jose or Prof Martin. I think that just makes it a little bit easier. Or as you can say, as Bernard has just said, the USA, the Netherlands, the Brazil presentation, if that makes it a little bit easier to remember. That's the way in which you can also post the chats, and then our esteemed guests will also answer you in the chats. Now, by no means do we have last but not least. In fact, I'm very honored and happy to also introduce you to Ms. Sarah Villani. She is a SPMA graduate alumni, and she was recently appointed as the municipal manager of the Midvaal local municipality. Now, Sarah has got qualifications from Tshwane University of Technology. She enrolled for the B.Admin Public Administration program at the University of Pretoria. And then she also moved on to the University of Stellenbosch. So there, you're in good company, Sarah. So you literally have people from all your former universities that are here. She is a top student. She is a fantastic senior government official. She's a mother and a wife, and she has, and she's very modest, completed everything that she touches. She completes with a distinction. And I think it's also going to be very interesting to hear specifically the perspectives from the South African environment, because we have had now the perspectives from the others. So Sarah, thank you so much for joining us and welcome.
Thank you so much, Professor Natasja. Good afternoon to everybody. I am quite excited to be joining the platform with all the esteemed scholars. I am must express that I'm not familiar with the technology. There we go. Thank you so much and good afternoon. We were requested to present on the resilience of the South African government in terms of COVID response. We are aware that we have seen our health system being put to the test. We have seen how unequal our society has been or is in terms of the distribution of food parcels. And the ugly head of corruption was also able to rear its head into the same discussion. So in my discussion, I'm just going to look at the introduction, the legislative framework in South Africa that would have been applicable during COVID, and the intergovernmental structures which would have been driving the COVID response. I would also like to touch on a few critical, controversial decisions which our government made. And we will also look at a few social policies that should have been implemented during COVID. And then I'll delve into the specific challenges which is facing local government, touch on a bit of policy reform and the communication links, and perhaps propose an intergovernmental structure communication framework. South Africa, like any other country, we had the president of the country declare a state of nation disaster. And during this period, there was a lot of restriction which was imposed, both on the movement of goods and the movement of human beings. And I think it is a universally accepted practice that when a state of disaster is declared or a state of emergency is declared, some of the human rights that we know and we tend to enjoy are suspended for a while. And there is almost a need or an emergence of an authoritarian approach in the way in which things are done. The impact on South Africa and the globe in terms of COVID has been very adverse. But what we have noticed is that there seems to be a move from regional pandemics. If we look at, for example, Ebola in West Africa, and we realize that now pandemics are becoming more global in effect. And we could attribute some of that to the rate at which globalization is taking place. But what is of interest is when we look at the COVID statistics, for example, Professor Margaret indicated earlier that we're standing at 1.2 million today. And if you consider this against HIV is currently standing at 35 million. So what makes this pandemic very different from HIV, for example? If HIV to date has killed 35 million people, and COVID has only killed about 1.29 million people. And so this speaks to the very complex nature of COVID itself, because it seems to have a ripple effect on many other societal issues, including the economy. If I can move on to the legislative framework that became immediately applicable to South Africa when the disaster was declared by the president in March. The act that comes into play immediately is the Disaster Management Act. And the uniqueness of this particular act is that it gives all the powers to the Minister of COGTA. So as much as the president is seen as the spokesperson, but all the powers are actually resting with the Minister of COGTA. And also together with that, it also brings into effect immediately the Intergovernmental Relations Act, which is meant to provide a clear guideline between the three spheres of government in terms of facilitating intergovernmental relations. What was also thrown in the mix because of the continuous need to ensure that there are internal controls in place, we saw National Treasury coming to the party urgently and issuing circulars almost on a daily basis and guiding all the spheres of government, specifically local government, in terms of how to go about procuring any goods during this critical time. What we have noticed as local government was the speed at which certain regulations, directives, and guidelines were being issued by our government. And for a moment, as a public practitioner, I almost wished that we had adopted this kind of strategy in terms of our general service delivery. And if this was how we look at society and society's problems and respond to that, if we had used this particular approach, I think we would have gone beyond the stage of being still called a developmental state. The next slide looks at what structure was in place or what structure is in place. And there is a lot of discussion and debate around the legality of this particular structure. But as it stands right now, we've got the National Command Council, which is made up of the President and Cabinet Ministers. Then we've got the Provincial Command Council, which is made up of the Premier and the MECs responsible. Then, just below that, at local government level, we saw the District Command Council coming into play, where all the different municipalities are now reporting to the district. And at local government level, we saw what we call the Joint Operations Centers. So the Joint Operations Centers ideally report to the District Command, and the District Command will report to the Provincial Command, and the Provincial Command will report to the National Command. But the information and decision-making was taking a top-down approach. So what these structures failed to do during implementation, they failed to recognize the distinctiveness, the interdependence, and the interrelationship between the three spheres of government. And I'll explain later as to why I'm making that particular observation. So there are a number of decisions which had to be made, and thank God, and we are privileged to have hindsight, because we all say that in hindsight, we all have a 20/20 vision. One of the key critical decisions which we noticed was around the level 5 alert, where the president would make a very broad statement. Generally, it was on a Sunday on national TV. And speaking broadly at an opportunity where everyone is listening, the president was not able to speak to details, because there is no expectation for the president to go into detail. So when the president made broad statements, we realized that certain information was lost in translation, and certain key information could not have been easily picked up at that broad level. For an example, when alert level number 5 was announced in the country, there is certain essential services which were supposed to have continued ordinarily. In the announcement, which did not come out clearly, was services like water and sanitation, because they are critical in the curbing of the spread of the virus, were supposed to have continued. But what did not come out in the communication was the non-essential services that enable these services to continue were stopped. Give an example. If we said, for example, somebody who was installing a water reticulation system was allowed to continue working, the suppliers of the mechanisms and everything else that is required to enable that were stopped from operating. So that made it a little bit tricky for that particular essential service to even continue, even if it was allowed to be a continuous perpetual service during lockdown. What we have also noted is there is very little evidence that was made available to the public that could indicate that there was a scientific method of decision making. Let's give an example. During level 4, the workforce was allowed to be at 33%. Yet, and the taxis were also forced or compelled to be at 33% capacity. But when you think about it logically, it is logistically impossible to allow a 33% capacity in a taxi, because a taxi does not go to one institution in terms of delivery, but it will go across a particular route and deliver to different employers. So there was a lot of unscientific decision making where that was concerned. We are also of the view that the National Command Council applied a very monological approach in communication, overlooking specific legislative imperatives. To give an example, there was an instruction that says, give all businesses business permits. There was not much consideration about the legality of the business owner, whether they're in the country legally or illegally. So by issuing a business permit, you're almost making that business owner who could have entered the country illegally a legal entity. The packaging of the information and communication within government speaking to itself, was a disaster. In one communication, the president is heard saying, we will allow the sale of cigarettes. And the very next day, the minister responsible for the Disaster Management Act comes back and says, cigarettes will not be sold. Now, these are two people within the same structure relaying two different contradictory messages. So both national and provincial government made decisions without consultation with local government, and the distribution of resources was a nightmare. And this is where then the ugly head of corruption also was able to rear its head. If I may move on to the next slide. So which legislations were then applicable during COVID to assist society, especially when we look at the issue of food parcels, the functioning of our health system? So the Social Assistance Act, which is a pure competency of a minister at a national level, became immediately applicable where the distribution of food parcels and relief was concerned. This was coupled with the South African Social Security Agency Act, which is also an act which resides in the office or under the Ministry of Social Development. So between these two acts, immediately you can see that there is a divorce from the local government level. Plus, there's about 15 other applicable acts which are not the competency of local government. So in this instance, we see social policies which require implementation by local government, but there is no relationship between the two in terms of competence and the powers to carry out and implement these. Some of the challenges which local government faced was land invasion. So in the communication, government said, at this point, you place all other bylaws in abeyance. So evictions and demolitions of illegal structures was completely prohibited. And what this means is that at the moment, at that time, we understood the decision, but we did not consider hard enough the downstream repercussions of what this decision meant, especially for local government. One of the other challenges which was faced by local government during COVID was the pressure on the health system. Ordinarily, the health service is not a local government competency. It is a competency of provincial government. It is rendered by local government. And so there was a disjuncture once again. One of the other broad statements which the president made on one Sunday evening was declaring that there will be a 20 billion stimulus package which will be given to local government. Once again, broad statement. And so what local government experienced out of that broad statement was the community coming in and saying, the president said we are going to give you money. Therefore, there is no need for us to pay for municipal services, which again meant a shrinkage in the local government offices. What COVID also did for local government in our instance is that it also disrupted the municipal planning and budget cycles. So everything had to be postponed with a good 2 to 3 months. And that on its own has got a serious impact on what we call the MFMA compliance calendar. As a result of COVID, again, we saw revenue streams being blocked. There was a lot of business closures, and it is still continuing. And the unemployment statistics are still on the rise. And the other social economic issue, which we are still contesting with SALGA, is the payment of special leave. When essential workers were required to work and to be on duty, while non-essential workers work from home, there is the question of, are we then entitled to special leave? But during a crisis, I don't think this should be a question that we even really entertain. So one of the other challenges that we faced was the stoppage of major services and the direction of funds towards PPE, protective clothing. And now you have to stop critical service delivery projects to try and curb the spread of COVID, which ideally is not within your competency when you consider that health is not a competency of local government. But because we are at the core phase of service delivery, there is really a need for us to then respond positively. What has also come to the fore of late is this, what has set in is the fatigue in reporting. So there is now an overload of information, there's an overload of required reports, and post the first 3 months, there is not much that we are seeing coming out of the reports which we are sending upward. We have also experienced losses of revenue as local government, and that has led to an increase in the number of indigents. And this is the one particular point where local government has got some powers. It is in this particular area that we've got one small little policy called the Indigent Management Policy or Free Basic Services Policy. And out of this one small little policy, local government is expected to respond to the social needs of our community during this time. We have also seen non-compliance with municipal bylaws, and this has also negatively affected the financial viability of municipalities. So looking at what we could call the policy reforms to accommodate co-production, one of the questions which was asked is, how can policies be reformed to accommodate private partners? Because during a crisis, you need all hands on deck. And we are saying that in terms of the Disaster Management Act itself, it calls that there must be involvement by the private sector. There should be involvement by non-government organizations, traditional healers as Africans, technical experts and volunteers in disaster management. But at the peak of the crisis, all of these other parties were completely disregarded from this particular process, or they were not seen as part of the solution to the problem. In fact, there was almost a need to place them aside while government was trying to figure this dilemma out. And so this decision went against the provisions of this particular act. What the next slide is just an extract of the act itself, which looks at who are the key role players in the disaster management forum, advisory forum. And from this particular act, it is clear that all of these key role players are supposed to be involved in driving the response to disaster. However, or sadly, it was not the case in South Africa, or there is insufficient evidence to demonstrate that this was taking place as it was envisaged in the act itself. The next slide is just a snippet of what our disaster management center organogram looks like presently. It has about 12 key positions, and it is said to say that of the 12 key positions, 5 currently, I'm not sure what has happened during COVID, but in terms of their website, 5 of those positions are vacant. And this is supposed to be the team that drives and advises the office of the minister in responding to this COVID. So if this is the case, as we see it, and we're saying that there is insufficient capacity within the established Disaster Management Act, what is it that can be done differently to ensure that South Africa responds or could have responded in a faster way? We're saying that we need to promote disaster management research as a country. We need to guide the development of comprehensive information management system, because what we are seeing emerging at a global level is that countries which had good information management systems were able to respond better. We are saying that we need to establish effective communication links within the role players, and to some extent, being Africans, we need to incorporate indigenous knowledge in terms of how we respond to disaster. And in creating our key performance indicators, we are saying they need to be smarter. And smarter in a sense that the E and the R will speak to ethics, or to the ethical aspect of responsiveness. And South Africa, on this one, we saw an epic fail, where funds which were meant to be directed to the poor, funds which were meant to be directed to UIF, funds which were meant to be directed to business rescue, were not used for the intended purpose. We're saying that the Disaster Management Center can also conduct disaster management mock drills. That has never happened in the country. In a state of emergency, South Africans generally do not know what to do. Our disaster management plans are just there as glorified documents that form part of our general IDP. And it is at this time that we're supposed to have used them as viable tools to assist us out of this particular pandemic. The other reform would be National Treasury is ordinarily supposed to have disaster funds ring-fenced. It is said to know that municipalities were only able to access disaster funds 2 months into the pandemic. Whereas ordinarily, if there's a fund that is ring-fenced, that could have quicker. As I'm about to close, I'm on slide 15. We're saying that communication links with role players could also be improved. And actually, communication should be happening from the local government sphere, where it takes a bottom-up approach. And it is very difficult to do that when all of the communication has been taking a top-down approach. And who is better placed to do this communication than local government? Local government is there in the coalface of local government service delivery. We have better insight in terms of what goes on in our communities. We speak the language. We are able to inform and advise the other spheres of government better. And we are able to mobilize and coordinate information much better, as we know that we've got many consultative processes which are embedded within the local government structures. So maybe the proposed decision-making framework is something that we might not be able to conceptualize fully, because we are looking at this whole pandemic in hindsight. But I'm saying that any pandemic cannot be scripted, and it cannot be prescriptive in terms of response. Our responses are supposed to be adaptive. We are supposed to be given room to be innovative. We are supposed to be given room to be creative. Unfortunately, 80% of South African local government structures and systems are dependent on national government for funding. So even if there are solutions within local government, when the funds and the dependency is on national government, it makes the reversing of the decision-making very difficult. So we are paralyzed in terms of responding to a pandemic, because we are not financially viable as local government to make decisions and follow through on those decisions because of our financial incapacity in general. And so, as closing remarks, we are saying that it has opened our eyes to the inefficiencies of IGR, and maybe it is an opportunity for South African government to introspect and to move away from very frivolous policies and beautiful policies which lack detail in terms of implementation. That brings me to the end of my presentation. Thank you, Prof.
Thank you, Sarah, for the insights that you have shared in terms of, and also your honesty, I think, in terms of the South African situation. So key to all of this is, I think it's almost cyclical that we got to a point where we're back to IGR, intergovernmental relations, and questions that quite a lot of questions posted on the chats refer to this. And thinking in part, we also need to be more clear in terms of communication. How do we build trust again? And specifically all of those IGR questions. I'm going to ask Prof Martin van der Steen first to respond. I see that there are quite a number of questions, and they specifically relate to, and you've had time to ponder on the answer, relating to, for example, Blanca has asked also in terms of the response, where the response is different from the cities in the Netherlands to that of national level. Prof Margaret asked, what do you think are the actual lessons that the Netherlands has learned? But then also, Ogopotsi Madumo, a doctor in our school, also wants to know if you think that, given that there is a smaller population in the Netherlands, if it's a different response that could be, which could also link, for example, to the question that Bernard was posing in terms of the common trend that we have in Africa in terms of top-bottom policies. So, Prof van der Steen, over to you.
Yeah. There are many different questions, and I think that one of the things about population size, I think, is not very important for the Netherlands. What is, I think, most important is that it's a very densely populated country, and COVID, well, spreads very fast in a very densely populated country. I think in terms of the response, what was a really big problem in the Netherlands was that there is the Netherlands is a very decentralized government, and so there is a central government, but there's a lot of autonomy for municipalities, and one of the struggles has been how to act in a coordinated and centralized way in a system that is essentially decentralized. So the Minister of Health in the Netherlands does not have that much power over municipalities to address public health issues. The hospitals in the Netherlands are not public, but are in essence private, or you could say hybrid entities. And so it is very difficult to lay out a centralized or a coordinated, I would use that term, a coordinated, collaborative approach. At the same time, I think one of the lessons to be learned from the Netherlands is, once you accept that the response has to be collaborative, otherwise it cannot be done, then I would say almost everything is possible. So we have seen, so in the Netherlands, they've almost worked without boundaries between central and decentral elements of government. It has been what you call in the literature a whole of government approach. So every aspect of government has been collaborating to tackle the crises. And I think the most important lesson has been that once you accept that you have to work around the problem, so you have to organize yourself around the problem instead of have these different layers with their own autonomy and struggle, fighting each other. Once you accept that, I think everything can be done. And that's an interesting lesson, I think, from the Netherlands.
Thank you.
Yeah. Maybe add one more thing. At the same time, the big debate now is that what worked very well in the wake of the crisis, so work across borders, collaborate, look beyond your own institution, that that worked very well in the ad hoc sphere of the crisis. But now, yeah, the question is, can we structuralize that? So how do you feed that back into the system as a whole? And that's very difficult. How structural can these changes become? And or were they just a one-time experience in the wake of the crisis?
So this isn't just meant for you, but in terms of and I'm asking this to all of the presenters. Professor Remy Ayere from the University of Ibadan, also a good friend of ours, asked the question concerning the decisions and the role of society groups in local authorities or municipalities' decisions concerning the handling of COVID. And how have these interactions affected compliance? And I think that links very well with Lino's question, one of our PhD students, where he also asked pertinent questions in terms of the various actors that are involved in the process, and how do we link all of this? And you have just said, getting it back into the system could be really problematic. But and I'm just trying to find Lino's question, and he's also asking in terms of resilience building, understanding the vulnerability and capacity, which are some of the lessons in terms. So you're asking what are some of the lessons in terms of community capabilities, local knowledge that policy actors focused on or should focus on in your cases, in building community resilience and address vulnerabilities that would include then organizational, so systemic, communication, economic, from the COVID-19 pandemic. And Werner Berger, he's also asking why are we so fixated on pre-prepared and nicely boxed solutions for puzzling problems. These wicked problems that we have to address. So this is actually not just a question only to Prof Martin, but to all the presenters. And then Sarah, if you wouldn't mind, perhaps also maybe respond to some of the questions on the chat itself that some of the participants are asking. And somebody said, what good is a policy? I think, Werner, it was you said, what good is a policy if it can't be implemented, or something like that. So yes, if we can hear from the presenters. So after
Natasha has gone, but I think she was saying that we could hear other presenters. So perhaps we would start then with Jose, and then to Sergio that you presented. Over to you.
Sorry, I didn't quite get the question.
Okay, so Natasha has just compiled the different questions in the chat.
Yeah.
And she's asking if the presenters would just turn, I suppose also given the time, to quickly give us some highlights. We don't expect that you would be able to answer all the questions. But so maybe instead of Martin, we can go now to Jose and to Sergio, and finally to Sarah. Just what do you think about some of these questions? That's what Natasha had raised. I think Natasha is back.
Yes, I am. Apologies. This is what happens when you do, ladies and gentlemen. So yes, if I apologies, I am back on power now. So yes, if anybody could respond, maybe we should give Prof Fernandez a chance now to start. Sergio?
Can you hear me?
Yes, we can. Thank you.
Okay, thank you. So I've tried to answer many of the questions along the way here in the chat box, but a number of the questions had to do with federalism or local autonomy, so I'll tell just a brief story about policy implementation. I remember sitting in Larry O'Toole's policy implementation course about 20 years ago when I was a doctoral student. Larry O'Toole is one of the world's premier policy implementation scholars, and we read some research, and he was lecturing on how conventional wisdom is not always correct, or is very contingent. So he was talking, early on, policy implementation scholars felt that to implement federal policies, having too many local actors was actually a bad thing, because it just increases coordination costs, increases the likelihood that there will be veto points along the way. People will just stall and slow down the implementation of federal policies. But here we have a situation with COVID where having many actors at the local level is actually a good thing. Having redundant capacities at the provincial and local level enables someone, helps to ensure that someone will step up and act to address a crisis or a pandemic in this case, when a higher level actor, for example, a central government, is incapable or willing to do that. So having redundant capacity, having many actors involved in implementation is not necessarily a bad thing. It depends on the situation that you find yourself in. So having a federal system with lots of local autonomy and local capacity allows for resiliency at the local level, local adaptations to crises.
Thank you, sir. Professor De Oliveira, what are your thoughts?
Yeah. No, sorry. Can you hear me?
Yes, Prof, we can.
Okay, because I could just see. No, I think that the issue of depend a lot how the institutions in the country is organized. In general, what happened is there are a lot of diversity went our local government. Could be anything. There are 1 million, more or less, 1 million local governments in the world, and there are different local, even in the same country. For example, when you're talking in Brazil, we have local government. São Paulo city is 12 million, and then we have municipalities of 700 people, and they have the same responsibilities. It's impossible to actually expect they will perform the same when there is a crisis like this. And this is why the intergovernmental relations are really important, because helps, those municipalities that can do everything by themselves and perform well, they need less help, but a lot of poor, with less capacity, municipalities, you need higher levels of government to work together to strain the capacity and their resilience. And then in the end is these, how much autonomy will depend, I think, how much the local governments can do. Even these, not all can do all the same. And also in cases like this, some are more affected than the others, depending where they are. And then you really need this system, I think, I would say nationwide, of a very high level, provincial maybe, to be well functioned to actually detect this difference and step in and to support when you have incapacity to respond due to resources, or sometimes do even these political differences locally. Then I think it's very important. You don't only think that the local government like isolated institution, but within local governments within a broad context, so provincial, even national, and even global in some cases. How you do that. I think you have to look at both the local governments itself, the capacities, the role, and constitutionally what it's supposed to be doing, but also this broader system that can support the local governments when things don't work well for different reasons. Okay.
Thank you. Thank you. Ms. Villani, Sarah, what are your thoughts? I see that there are also quite a lot of questions posted to you and that you've already started responding.
Yes. Thank you, Prof. I think from where I'm sitting, there is only so much that any government can do to respond to the crisis. I think beyond COVID, we should be asking the question, what are the opportunities which are deeply embedded within COVID? COVID is now presenting us with an opportunity to interact better with our communities. In other words, we no longer need face-to-face interactions. A lot of municipalities over the past few months have been very innovative, coming up with apps to engage better with the community. So we should be looking at the opportunities embedded here in. We have learned the lessons, we are learning the lessons, we understand it's about social distancing, we understand it's about wearing a mask, we understand it's about keeping good hygiene. So, but beyond that, as countries, we should be asking, the next step is, what is the economic recovery plans that we have in place? Because that is, for me, is the only way you can meet the crisis head on. One of the professors indicated that at some point in time, we need to live or decide to live with the crisis. And so in living with the crisis, let's look at the opportunities, develop clear economic recovery strategies and implement those. Because these pandemics with the rate of globalization, they're not about to stop. So we need to find a way to coexist with such.
Yes, indeed. Thank you. Thank you. And yes, as you can see, you know, thank you, Sarah, specifically for your insights, and that we know that, well, definitely Midvaal local municipality, that they are in good hands. And as Sarah said, so I actually do follow Midvaal on Twitter, and they communicate quite a lot with citizens. And I think that is one of the biggest issues that came up through all of the discussions, as well as the communication part, and keeping citizens informed in terms of what is happening. And even as you have indicated, Sarah, in terms of hygiene. So, so from a personal perspective, well done to the municipality. And I know you took over amidst the COVID crisis, and you couldn't even meet your people from face to face, but she made a plan, and I think there is also a lesson to learn. So, do we have any particular questions that you would like to voice to our participants? We will be finishing at past. So if you have a particular question, you are welcome to raise your hand, or still post it in the chat box. So if there are anybody who would like to post a voice question, raise your hands. Otherwise, I am going to ask our facilitators, or not facilitators. You can see I am a lecturer, and you can see from the office, I am in my office. So I work the whole day with facilitators. Our very, very capable presenters who so kindly made their time available. Any parting thoughts that they would like to share with us? And I'm going to start that in the order of our presentation. So, Prof, just say, any parting thoughts?
No, I just, I thought it was very interesting presentations. I thank you very much for the opportunity. I also learn a lot from my colleagues, and see this really, a global challenge. I think it's a lot of opportunity also to learn from each other. That think innovation. You have to innovate a lot in the way you are dealing with COVID, because something that you have never seen before, at least last 100 years. And the role of local governments is very important, I think, and then can learn from experience of other countries, but always put in this context that you not only the local government context, institutional context where this local government is interacting with other local governments and higher level governments, even in national and international organizations. And this I learn a lot from my colleagues, and I look forward to share more of this experience in the future. Thank you very much.
Thank you. Prof Martin, I see you are typing. Yeah. Parting thoughts from you, and of course you can keep on to respond.
Yeah, I was trying to respond to some of the questions in the chat. That was which I really enjoyed, and I will try to continue that. Thank you for the discussion. I think what I was hoping for was that it would be a debate instead of for people talking, and I think that really worked out well. In the sense that there are so many questions and sharing of ideas and everything. So thank you for all that. I think, well, COVID is terrible, but it provides also an opportunity to learn from each other, since we're all basically in the same boat, and that is interesting as well. And so thank you for the invitation and the ability to talk to you and to learn from you. So thanks.
Thank you so much. Thank you so much, Professor Sergio. Final thoughts from you.
I'd just like to echo the comment that some of the presenters made about finding opportunity in adversity, and I anticipate that the pandemic will bring all sorts of unanticipated positive effects on society and on institutions. For example, I think just about my university and how many of the instructors were reluctant online instructors, and seemingly overnight everyone had to become an online instructor. So I suspect universities will significantly expand their online course offerings. I expect higher ed to be democratized and to spread much more quickly. We've all learned, I think all sorts of organizations have learned that we can do a lot of our business online and save on all sorts of overhead costs by doing work online. Yeah, I think there are opportunities to move forward and learn from this experience and benefit in ways that we can't even anticipate at the moment, because we're still sort of in the thick of it, trying to get past the crisis.
True. Thank you. Sarah.
Professor, thank you so much. I think it was a pleasure for me and a great honor to share a platform with the esteemed scholars. As a practitioner, it makes it even so more exciting. And it says to me that we need to build resilient government systems, because in the presence of systems which work, responding to anything is easy. So we're looking forward to the direction of our government as a responsive local government in a developmental state. We're excited to be seeing opportunities in all of this, indeed. Thank you, Prof.
Thank you so much, Sarah. So from the SPMA side, thank you once again to our wonderful presenters. We know that if this was face-to-face, we would all be applauding you. So I am applauding you on behalf of everybody. Thank you so much for your time. Thank you for your valuable inputs. Thank you still for the answering. I saw Nati also asked in terms of the procurement corruption, that really, especially in our province also, it's beyond, I cannot even understand how big it is. But once again, thank you so much. I think one of the things that we have also learned is that in terms of COVID, there was that poem and poster which said that we are not all in the same boat, that we are all in the same storm. And I think our presenters gave us their different perspectives from the boats that they came in. So whether it was from Brazil, also with IGR bringing in BRICS and all the questions that we have, Prof Martin, you from the Netherlands, Sergio, the USA examples that you shared with us, and then Sarah sharing with us the South African environment, and response, and the rocky boat that we are in. And I think in terms of the continent, we have a lot to learn, and we can learn from one another. And I'm sure, Unati, we need to go knock on the doors of Prof Martin and the Netherlands to find out more, because corruption is also one of the biggest elements that reared its ugly head in the disaster that is facing us, and that is something that will stop resilience. If we want to have resilient and responsible governments, we cannot allow corruption to happen and to take over the dragon with the many heads. Bernard, just again, thank you for your question. We will so those that we have the email addresses to, we will mail you the link. The link will be on our SPMA website, and that is where we will, with permission of course from the presenters, make available their slides. And then this recording will be also available, but in terms of Blackboard, behind the scenes, it just takes a little bit for it to process. So it goes overseas actually and comes back to us. So the presentation or the session, the synchronous session, the webinar will be available as of from tomorrow. And we will actually also download the chat, because I think there has been a lot of really good insights that you have shared with us. So from the School of Public Management and Administration at the University of Pretoria, I thank everyone, our presenters, our participants, our friends, colleagues, family members from not just South African universities, but through the whole continent, and also from other countries. Thank you so much for spending your time with us, and we hope to see you soon at another webinar that will be hosted by the SPMA. And once again, presenters, thank you so much. We truly appreciate it. Thank you, and goodbye from me, Natasha. Bye-bye. Goodbye. So I'm one of those people that wave.
Thank you. Bye-bye.
Bye-bye. I wave. So I'm waving. Goodbye. Thank you for being with us. Dudu, do you want to ask a question? Blanca, thank you so much for joining us. Thank you so much. Goodbye, Bernard. Thank you to all our PhD students. Thank you, everybody. Thank you, the SPMA. And Prof Milan for organizing this. And Charmaine and Udil. Thank you so much, everyone. And we'll see you soon. Thank you.